Let's discuss rosacea, redness and sensitive skin. A lot of people suffer from the chronic inflammatory condition called rosacea, and that's a condition whereby the blood vessels are permanently dilated. You can experience red flushing, and in more advanced cases you can experience acne rosacea with fluid-filled pustules on the face, and even it can go to the nose with rhinophtema, with an enlarged nose, and even the eyes. It isn't curable, but again it is controllable, which is really important. So rosacea is a condition that you can actually alleviate with better forms of food. Not having spicy food, obviously, not drinking too much red wine or white wine or high levels of alcohol, but also minimising overheating with exercise. What can we do though as regards skincare? The key with rosacea and any inflammatory skin disorder, whether it be eczema, dermatitis, psoriasis, or even general inflamed skin, is to minimise irritation and inflammation. Every underlying negative skin concern comes down to one common cause, and that's inflammation. So we need to minimise the inflammatory markers in the skin. So we don't want ingredients that are going to make the skin feel irritated or inflamed. So we really need to avoid acidic products like alpha hydroxys and beta hydroxys, although beta hydroxy or salicylic at very low levels is okay, but not at high levels. And we need to have ingredients that nurture, calm and heal the skin. The hero ingredient for redness and irritation in the Synergie range is Dermacalm lotion. Now this is a calming lotion with a multitude of active ingredients designed at minimising irritation and inflammation. You've got your telogen, which is a peptide which reduces redness and stinging and reduces the appearance of the fine visible blood vessels. You've got delisins, which is another peptide which actually reduces the stinging sensation. You've also got the phycosaccharide, which helps to repair the skin, and most irritated, inflamed skin has a very compromised surface, which is often flaky and red. You've also got your Canadian willow herb, alpha bisabolol, aloe vera, beta-glucan and colloidal oatmeal. All these ingredients calm, soothe, nurture, nourish the skin. I don't even add essential oils to Dermacalm. I love formulating with essential oils, and I don't use artificial fragrance. However, some people with highly sensitive skin can be susceptible to essential oils. So this has got a lovely oaty sort of smell. It's a beautiful, nurturing moisturiser. If you are using it during the day and you choose not to use Uber Zinc as your moisturiser, do use a high-level mineral makeup like the Synergie Minerals with the 50% sunscreen built into it. Otherwise, using Uber Zinc, zinc oxide is a natural anti-inflammatory. With 21%, it's going to bring down the inflammation and the redness of the skin, and that's your day moisturiser and sun protector in one. You can exfoliate when you've got sensitive skin and even rosacea, and if you are, you need to use Luciderm. You don't need a scrub. You don't want to use a scrub. It'll be too invasive and too abrasive, and obviously you don't want to use acids, but Luciderm works on a different level. It's 100% acid free, and it will help to loosen the dead skin and give you that luminosity and that lovely clear appearance of the skin. Again, vitamin B is a lovely, lovely ingredient. It actually reduces inflammation. It increases the integrity of the skin, makes it stronger, increases the immunity of the skin. So it's a perfect ingredient, niacinamide, for inflammatory skin conditions. So if you have rosacea, inflammation, irritation, I would recommend you use BioCleanse as your cleanser. Ultra Cleanse may be a little bit too high in foaming agents. So BioCleanse morning and night. Your go-to serum will be vitamin B. I would even use that morning and night. If you can use vitamin A, that would be great. Some people would just like to use the B though and keep it simple. And then your day-night moisturiser can be Dermacalm. If you're using it during the day, you need to use a sunscreen over the top. And of course, if you do need to exfoliate, you can use Luciderm as your serum. Maybe you can use vitamin B at night and Luciderm during the day. So serums during the day, morning and night, and moisturiser Dermacalm, you can use that morning and night. Remember, the key with rosacea, eczema, psoriasis, any form of inflammation is to work on the reason the skin is inflamed. Look at diet, look at lifestyle, and look at topicals that minimises the appearance of inflamed skin.